Our client is Craig, who is a 36-year-old man who fell off a ladder and he has a complete fracture of the spinal cord at the C5 level. And so one of the areas of occupation that we want to address during his acute care is ADLs because he is currently independent in all his ADLs after completing his evaluation. Another topic that we want to address is IADL, which is safety and emergency maintenance to prevent any future injuries while he is at his job. And another is work because that is one of his goals. And he owns a cell phone store, and as of now, he's unable to go back to work. But if we educate him on modifications and adaptations that we can provide to him in his workplace, we can hope that his business will be able to support his family so that they're able to accomplish their goals. So given Craig's emotional state, we would introduce the occupation of work so that he's able to return to work and financially support his family. And again, that was one of his goals. He wants to be financially stable to start a family with his wife. And in order to help Craig and his wife, an occupational therapist can introduce the occupation of work and job performance, and he can be educated on modifications and adaptations that will allow him to continue working at the cell phone store. So in the area of self-care, we were going to address functional mobility because Craig, he's currently having flaccid paralysis throughout his upper extremities and his lower extremities. His cognition, perception, vision, and hearing are intact, and due to the paralysis, he will be educated on moving positions and functional ambulation. Functional mobility will be necessary in order to perform his job at the cell phone store, and it will also help him to change positions while performing other ADLs such as dressing, bathing, and grooming. So we do believe that Craig will be able to eventually dress himself, even though he is dependent as of now, but we can provide him with adaptations and modifications for dressing according to his level of injury. And this can include adaptive equipment such as button hooks or a dressing stick. And he'll be educated on how to perform dressing in a modified way. So we do believe that he'll be able to successfully return to work after rehab just because his cognition is intact and he will still be able to interact with customers. His vision is intact and also his hearing. He'll also need to get some modifications and adaptations as far as moving around the store or doing anything that requires motor skills. He also has 2 employees who can help him out. The next part we're going to discuss are cultural factors. And this one, it's important as an occupational therapist to be educated on a client's values, beliefs, and cultural heritage. And we would educate ourselves by asking Craig and his wife, since they both share a similar heritage and belief system. We would ask them questions, and also we would research more information about their culture so that we're better able to understand their background and exactly which culture they belong to, and also plan the intervention based on their personal goals and motivation after having a discussion with them. So Craig's roles has been affected by the accident. His 3 main roles that were mentioned in the study was being a worker, a cell phone store owner, a husband, and also he hopes to become a father one day. So as a worker, his roles has been affected because he's currently unable to perform his job and he is in acute care right now. Also, as a husband, he wants to be able to support his wife, but he's currently not able to. And also, as a father, he wants to be able to start a family with his wife. Next, we're going to talk about the performance skills that should be addressed during Craig's stay in acute care. And during the OT evaluation, we found out that he didn't have any deficits in cognition, perception, vision, or hearing based on the observation and interviews. So we can address the motor skills to enhance his overall performance while he's in the hospital. And the ones that we came up with were walking, positioning, reaching, calibrating, manipulating, aligning, lifting, and transporting. Because Craig has a C5 spinal cord injury, he should be able to have some movements, and this includes moving and raising his arms above his shoulders, and he should also be able to bend his elbow. He can speak and use his diaphragm, but breathing will be weakened. Our intervention session is going to address 3 of the performance skills, which includes positioning, manipulating, and transporting. And this is because he currently needs assistance with these skills. So our intervention session is going to be based on ADLs and IADLs as mentioned earlier, and safety and work modifications. So some of the things that we're going to address is proper positioning when performing ADLs, manipulating objects safely, and transporting objects with modifications and adaptations so that he's better able to meet his goals. For Craig's emotional state, we know that he's gone through a traumatic event in his life, which has affected his emotional state, his career, and his family life. He will most likely be frustrated and impatient given the level of spinal cord injury. Therefore, it is important to be empathetic towards Craig and listen to him as he shares his thoughts and feelings. It is also important to understand and try to understand his point of view.